not many people know about functional medicine or gut health. And I'm wondering, what is your perspective on this? Why do people not know? Why are we not educated on this versus the traditional, let's just go to the doctor and get a prescription?
Gut is where ill health begins. So anyone coming to me with a diagnosis of hypertension, diabetes, heart disease already
Mhm.
has a compromised gut health. Functional medicine is more like, changing your lifestyle, right? There's no drugs involved.
Mm.
So I do think that advertising for a lifestyle change is so much harder compared to a drug that's on TV, right? There's so
Yeah.
many drugs that are like constantly being, advertised.
Hey there, everyone. I have a special guest today. Really excited about this topic. I think it's just prevalent issues that are happening today, have probably been happening for a long time. And there's things that we just aren't educated on, which is functional health, gut health, functional medicine. And so my special guest today here is Rekha Murali with Rekha Murali Functional Medicine. She's an MD, so we've got an expert in the house. Really excited about that. And I'm just really excited to be able to teach you guys something, have something new here, something that we may not be thinking about all the time, but really, really important to all of us, not just seniors, all of us, really. So Rika, thank you so much for being here today. Tell me a little bit about your practice and what is functional medicine exactly?
Okay, but first, let me thank you. I'm excited to be here so I can share what I know to get people healthier. But functional medicine is basically a root cause approach. It's more about looking into someone's microenvironment, but in a
Mm.
holistic way. So when we talk about functional medicine, is how to get somebody functionally back, right, to good health.
Mm.
Most patients we see are dysfunctional, and they may be dysfunctional partly or wholly. There's so much, variations in the level of dysfunction, right? So looking at functional medicine, we are looking at four key factors. These are called the pillars of functional medicine, and that includes sleep, diet, exercise, and mental health. So if somebody wants to be healthy, you want to keep your four pillars really strong. So
Mm.
I compare the four pillars like, four legs of a table. It's just easier to understand. So
I
if
like
you have one leg of your table off, your table gets a little shaky, right? But if
that.
you
Mhm.
have two legs off, your table is going to crash, right? That's when someone
Mm.
really comes down with some illness and then they need a lot of help. So and we do check, in functional medicine for the microenvironment, we're looking at, mitochondrial health. I don't know if anyone knows what the mitochondria is, but that's the engine of the cell, right? That's what's keeping your cell driving to keep someone alive. So if the mitochondria is suffering, it's not optimized in its health, then that person can have fatigue, you can have some chronic disorder. So we want to look at making sure the cell health is good. We're looking at gut health. We want to make sure the gut is healthy. We're looking at toxins. Is someone getting some overload of some toxins that's affecting the cell health? We're looking at nutrition. Are they having the right nutrition for the gut health for getting enough nutrients? And then we are testing also sometimes for hormones. We're looking at, other kind of testing that we do for mold, for example, heavy metals. So there's a lot that goes into functional medicine.
Yeah, there's a
So
lot. But it sounds like it's a holistic approach to
the
your
holistic
overall
approach.
health. What I love about this is that it is a holistic approach. You just mentioned the four pillars. I know when I go into traditional Western medicine, I go into a doctor to, say something doesn't feel right. They're only looking at that one thing. And
Yeah,
sometimes it's very surface level of how they're assessing you. They're not looking at what caused this to happen. And
exactly. Mhm.
for me, that's always a problem because, and it really should be a problem for everybody because there's a reason why something's going wrong or you're having a pain or an ache or an issue, right? There's
Yeah.
something causing that. And like you said,
Mhm.
there's the four pillars to assess, which I love. Um, and you mentioned mitochondria, right? You said
Yeah.
mito. Now, I was in nursing school many, many years ago. I didn't complete nursing school, but like
Mhm.
mitochondria, where there's the little wave-like little, I imagine like little
Yeah.
tiny hairs or fibers inside of like the lining inside of your gut, right?
Yeah, the
Or, no?
mitochondria. sorry. Mitochondria is in every cell. So it could
In
be in the
every
gut.
cell.
Every cell in your body, basically.
And does it kind of move things around and pass things? So it helps to move.
Yes.
Okay.
Yes. So mitochondria is actually like a little structure inside the cell. So they're really small.
Mhm.
And then they have a lot of functions that they do inside that. So they have a lot of, for example, toxins come in through the mitochondria, right? And if you have too much, the mitochondria cannot get rid of it. Then that can affect the functioning of the mitochondria, of the cell. So, for example, a simple, example would be fatty liver. Have you heard of fatty liver?
Yes.
Yes. So that's fat deposits inside the cell in the liver, right? So it's making the liver cells kind of dysfunctional because those cells can't operate because they have so much fat in them that the mitochondria cannot function well. So that's why if you look at the liver, in ultrasound, it looks like this, this whole bunch of liver cells that have lost their architecture because they're just seeing all these fat goblets inside the cells. So it becomes like like it's not really functioning well. That's why most patients will notice a liver test that comes abnormal, and that would be the first clue, to the fatty liver.
Yeah, I like that. I like all the analogies that you have helped to give people or our audience kind of a way to envision what's happening in our bodies. You
Right.
also mentioned sleep, and I know this isn't, I mean, it's part of functional medicine, right? But people don't
Mhm.
really imagine sleep. That's something that's really going to impact my overall health. Maybe I just feel tired if I'm not getting enough sleep. But how is this really impacting us? I know as I get older, and we're talking about serving seniors, but even for me, I'm in my 40s and every year I feel a little more tired. And I know that I need to honor my body and get more sleep.
Yeah.
I call myself a little bit of a princess. I need 9 hours of sleep, which is quite a bit, but that's how I optimize, my health and I feel
Yeah.
my best. So what would you say about sleep and what's ideal sleep and how does it impact us if we're not getting that ideal sleep?
Yeah. So if you don't get enough sleep, right, all of us needs at least 7 to 8 hours of restful sleep. If it's
Yeah.
interrupted with having to get up and go, and then when you come back to bed and you don't sleep, that affects your hormones. So your cortisol level, which is your stress hormone, can go up.
Mm.
Your stress hormone, it's great to have it go up when you really are stressed out for a short time, right? So, for example, if you're going for the Olympics, you want to run, your cortisol is going to be high, and that gives you that adrenaline surge, sorry, so that you can run
Mhm.
faster, right? And you can break
Yeah.
some record. But if you have cortisol always high chronically, that can actually mess up your other hormones. It is a pro-inflammatory hormone, so it can affect your gut lining, so it affects your gut health and it can cause inflammation. And inflammation is definitely not good for the body, right? So the inflammation from the gut can go to your brain, so you can have brain inflammation from poor sleep over a period of time. So that's why you get fatigued because your brain is not getting rest. Your brain needs rest during sleep. That's the only time your brain can do its metabolic activity during sleep. The liver, for example, also does its work of detox during sleeping. So if you don't sleep enough, you're cutting down the activities of your organs that work during sleep. So that's very important to understand.
Yeah. You're saying so much. It's just such an interesting topic. I wanted to backtrack a little bit, although you're starting to say things like inflammation. I'm like, ooh, let's go down that rabbit hole.
Yes, I know.
But but I wanted to actually learn a little bit about you. I know I wanted to first say, what is functional medicine and how is it different from what we're used to with traditional Western medicine? But what inspired you to actually get into functional medicine? And could you tell us a little bit about how do you serve seniors in terms of functional medicine?
Yeah, so to answer your first question, I got interested in functional medicine, after seeing my mom. So my mom was a very healthy person and she was very strong. She was working as a lawyer, so always on the go. And
Mhm.
she got diabetes. She had high blood pressure, she had high cholesterol, and she had three mini strokes, and she
Oh.
had two stents placed in her heart over a period of time. And
Mhm.
she was a really good patient. She went to the doctors, and anything the doctor said, they said eat this, she would eat that, and so she was very good with the exercise. However, she still got all these complications.
Mhm.
Now, looking back, I was thinking her stress was never addressed, her sleep was never taken into account, and she never ate timely meals because she was on the go all the time. So I think all that, in addition to having diabetes, high blood pressure, those medications that she was on. So she was on a bunch of medication, probably like 5 to 8 medications. And I'm not saying medications are bad, but they do have side effects, right? They do
Yeah.
cause problems with the gut bacteria. They actually downgrade the gut bacteria so they cannot thrive as well. And so you get overgrowth of bad bacteria. So these were things that I was not aware of until much later in her life. So I realized that gut health, is not something that happens overnight. It occurs over the years that we can mess up our gut health. And gut health is what drives, the immune system. There's a lot I could talk about gut health. But going back to your second question was, how can I serve seniors, is bringing that education, because I think the knowledge factor is missing in a lot of people. They don't know about functional medicine. They don't know what is gut health
Yeah.
or how does gut health impact, your life. And I think understanding that is very important. So I'm trying to get the word out about functional medicine, how the gut health affects your health, and how we can improve your health despite no matter where you are in your process of your health, whatever disease process you have, we can still help you. So
Yeah.
that's just to
I
get that
love
out.
that. And I love to hear your story, your personal story about your mom and
Yeah.
why you were inspired to get into this line of work. And I'm wondering, not, we've said this a couple of times already in just a short time of airing, but not many people know about functional medicine or gut health. And I'm wondering, what is your perspective on this? Why do people not know? Why are we not educated on this versus the traditional, let's just go to the doctor and get a prescription, which, as
Yeah.
you noted, and I know myself, that's not always the healthiest thing for our bodies. We
Yeah.
really need to take care of our body from the inside, and do different things that we're not taught about. So why do you think that is?
Yeah, I think because functional medicine is more like, changing your lifestyle, right? There's no drugs involved.
Mm,
So I do think that advertising for a lifestyle change is so much harder compared to a drug that's on TV, right? There's so
yeah.
many drugs that are like constantly being, advertised. So that would be one thing. And I'm not against allopathic or Western medicine. It has its place.
Yeah.
It does help to control diabetes or whatever, the problem the patient has. However, when you combine the two, when you combine Western medicine with functional medicine, you actually benefit a lot more, because wherever the gaps in care are, that's where we step in. So I call myself like a bridge, so we can bridge all those gaps that is not being
Mhm.
taken care with allopathic or Western medicine, and then we can still get patients healthier.
Yeah.
Yeah.
I really like the thought of pairing the two together to really overall just help your overall health, and optimize your care. So
Mm-hmm.
tell me a little bit about, you mentioned some of the symptoms we can have, some of the things that could be a result of not having good gut health. What are some of the things that you typically see in seniors where you recognize, okay, this is a gut issue, where we have to kind of figure out what's going on in the gut and why? Are there signs and things that you see commonly in seniors that you automatically know this is a gut issue?
We do know. So first, I'll talk a little bit about gut health to improve the understanding. So gut is where ill health begins. So anyone coming to me with a diagnosis of hypertension, diabetes, heart disease already
Mhm.
has a compromised gut health. And the reason I say this is because gut is supporting digestion, right?
Yeah.
Digestion starts from the mouth, and actually from the mind. When you think of food or you're hungry, you're already having your saliva being secreted and you're getting ready to digest your food. Your acid gets secreted in your stomach, and then you're starting to, make your digestion better. But as your digestive process goes on, your gut health is also supporting nutrition, because once your food is digested, your gut bacteria helps to break them down further into nanoparticles so they can be absorbed into the gut cells and actually go into your bloodstream. The other thing that gut health is important for is for the support of the immune system. So whenever you have an impaired gut health, you run into immune system problems like autoimmune disorders. For example, rheumatoid arthritis or psoriasis. There's a whole bunch of autoimmune disorders out there. So that tells me already they have a compromised immune system. Now, mental health also is very dependent on good gut health. Interestingly, there are trillions of gut bacteria that actually produce neurotransmitters. And neurotransmitters are biochemicals needed for one nerve cell to talk to the other. So if you have less neurotransmitters being produced because of some displaced gut bacteria, you're not going to have a good mental health. You're going to have problems with anxiety, with sleep, with depression, with bipolar. And of course, there are also genetic factors that may contribute to this. So usually genetic factors with environmental factors can contribute to a lot of disease processes. But we know now that we can actually help even people with genetic disorders to overcome that by using the power of a good nutrition, by looking at their sleep, by making sure they exercise well. And we come back to the four pillars, right? Making sure their stress levels are down. And also, one last thing that the major part that the gut does is detox. Anything and everything we eat, our gut health helps us to eliminate those toxins, right? So if you don't have good health with your gut lining, then you might reabsorb a lot of the toxins instead of actually eliminating them. So this is just an overview. The gut health is a lot more, functions that are there that I haven't mentioned, but these are the major ones. So maybe now you can understand if someone comes to me with indigestion or they're having bloating and then they're having a whole bunch of medications that they're on, I already know their gut health is compromised. So we're going to be focusing on that.
After you explain this, Rekha, I feel like everybody has gut health issues. I
Yeah,
mean,
it's good because even me, I have that
yeah,
too, you know?
I
So,
even see, commercials or whatnot targeting even young children, and it's so true. And they talk about ADHD and just different personality issues or mental health issues. And they start to talk about the food that they're eating,
mhm,
which it makes sense now, right? It's the food that
yes,
they're eating that's compromising their gut health, which is
yeah,
then, impacting their neurotransmitters, like all these things, right? We could get very scientific into this, but
yeah,
wow, how enlightening. I think everybody needs to have education on this, just a class or two or five around this,
mhm.
and really learn about our gut health because, like you're saying, it impacts everything. It impacts
Impacts, yes,
everything, right?
yeah.
So when you're working with seniors and you've identified that they have a gut health issue, um, I mean, is there this is a hard thing to say, and I'm probably very taboo for saying, but is there an ideal age as we're as we're aging and maturing where we can say it's too late or this is a good time to start looking at our gut health and making changes to improve our overall health? Or is there a
Yeah.
time where you're like, it's kind of too late to do anything?
Yeah, so that's a very good question. Actually, a lot of people, when they come to me, are already in a pretty advanced state. They
Mm,
have autoimmune disorders, they're already on a lot of medications that suppress the immune system, right? And then they suppress the gut bacteria. But we're still able to work around that. So there's no such thing as being late, unless, for example, this has happened years ago that I had a patient who was on dialysis asking me if I could help him with his kidneys. Now that's not possible because the kidney shut down, right? So that person obviously I cannot help. But anyone who is doing, even if they are feeling like they're on so many medications, whatever be their level of illness, we can still help them to
mm,
optimize. Now, we may not be able to reverse a lot of things. We don't do, say, reversal. We can improve the health. And we do often get patients off their medications or at least on lower doses, which is really remarkable because for those patients, being on lower doses means less side effects and less problems with interactions with different medications. So everything matters.
yeah, everything matters, I say.
Yeah.
Is there ways that seniors can incorporate gut health practices into their daily routines to improve their health?
Yes, absolutely. Just being mindful about what they eat, staying away from packaged foods, for example,
Mm,
eating more wholesome foods because we know packaged foods are made in a food lab. So definitely not a good thing because they add so many preservatives, coloring agents, and and fillers that are really harmful for the gut bacteria. So just eating wholesome food is really good. And that's why it's hard because when you look at labels, there's so many things in them. If you don't understand all the names of them, they're really definitely not good for you. I think making sure you exercise, even if it's a little bit, even if someone is not able to walk as much, right? Even trying to improve that exercise tolerance is important. Doing breathing exercises, taking care of your mental health, doing meditation, that's important. And, just keeping, being happy with a good support system. Now, this is really important because social support is really good for mental health. I don't know if you saw that program on Netflix. There was something about the blue zone.
Oh,
Do you remember?
yeah. Yes.
Right? There's so much focus on the social life because even if someone is having some problem with their health, when they have supportive friends and family, they live longer because they're able to
Yep.
somehow balance some of their gut. So that's important to understand.
That's amazing. Do you foresee that as we're kind of transitioning? I'm going to backtrack that. I feel like we're in a place right now where people are paying more attention
Mhm.
to processed foods and wanting actually more whole foods. They're starting to pay attention to those bad dyes, as you mentioned, and the coloring. Um, and so I do think it's a really good time to get out there and for people to start to learn about this and learn about functional medicine, learn about
Mhm.
your gut health, learn how food impacts us. Are there um, resources out there that seniors or adult children can get to help them understand this
Mhm.
is how we should take care of our bodies. These are some of the things we can do, and really give them the kind of tangible tips and tools on how they can pay more attention and
Yeah.
be more intentional on their gut health.
Yes, absolutely. There are many, many resources. The Institute of Functional Medicine is one of them. It's a really good website. If you go there, you can look at all the different, webinars that they have, a lot of information about food and mental health and exercise and everything that we talked about. And they
Mhm.
can also go to the EWG website, which is the Environmental Working Group website, which tells you all the toxins and what foods are healthy, what chemicals are there, even in your cosmetics, in your lotions and things that you have in your home. And generally, you can go to the Harvard website. They also have some information on gut health. So many of the major, universities have a lot of free information on gut health. But I think I would lean towards the Institute of Functional Medicine. That's where I trained from. So they have lots and lots of resources.
Awesome. Thanks for that. And I really want to understand the process. If you are seeing someone, what does that process look like from the very start of someone comes to see you, there's some issues. How do you assess them and get them on the right track?
Yeah, so first we offer like a free consultation for like 30 minutes. Believe me, though used to say 20 minutes, it always goes into 30 minutes. So I'm just saying it's 30 minutes usually. And I have patients, bring their medication list, give me their, the supplement list or anything else that they're taking. And then we dive into a more detailed conversation where we'll be discussing, what are their challenges? What are they looking for? And is that something that we can help them with?
Mm.
The second part would be, are they ready to make those changes that we want them to make? Now, I'm not saying that everyone has to make like a complete 365-degree turn. That's really hard. But that's the reason I became a health coach, is to find out how to change their mindset so they can start doing some of the changes that's required, right? But they have to have the willingness to be able to do those. So those are the key things. So once I'm looking at that, and I think we both have a good understanding, we're on the same page, then we take them into our program, and and then we start from there.
Awesome. I love that. And it really is about change, right? We have to wrap our heads around we have something that's going on. We need to take action and make change and make a commitment to this. And that can be hard for people. I know it's hard for me when I say, okay, I can't have anything sweet at night,
Yeah.
just that little tweak. Even if you do a lot of the right things, there could be one thing that's wrong or that you're doing that's not so healthy or good for you that we have to change. And so having that support and that mindset coaching is really, really helpful. just to get people on track and encourage them and be a support system for them. So I think that is a great asset to what you do in
Mhm.
helping your patients to really stay on track and have great results. Can I ask you, is there any challenges that you foresee in the near future with functional medicine in the senior community, in helping seniors and making sure that they're getting the right support or that they're getting great results?
Yeah, so I think with the seniors, the first thing is the mindset, right? Are they willing to make the change? That is
Mhm.
definitely something to consider. Secondly, is are they are in a supportive environment where they can support themselves to follow, to follow through with whatever we are recommending. So that's the second thing. And I think the challenges are a lot of people are, stuck in their habits that they don't want to change. And
Mhm.
so that is a challenge. But once people understand the reason, once they start feeling better, a lot of that changes. So that's why I love to first educate patients because when they start trying little steps, baby steps, I'm not expecting a whole lot in the beginning. When they start taking baby steps and they start seeing improvement, they get motivated to do more. And that's the key thing is motivating patients, educating them so they understand more about themselves and once they leave us, once they finish their treatments with us, I want them to continue to be healthy and understand what their unique challenges are. Because functional medicine is so personalized, right? I think I
Yeah.
missed that part in the beginning. Because every patient's gut health is different, everybody's medication is different, their challenges are unique. So we have to tailor our treatments to that uniqueness that is there in every patient. So making sure that they actually understand their unique challenges when they leave us, they know when to come back or they know how to deal with it a lot better than if they had never seen us. So that's what I would say is for the seniors a big challenge.
Yes, I definitely can see that being a challenge. I know in the senior living community aspect, we have chefs and we try to cater to our residents' dietary needs. But it can be challenging. Even if we have a ton of options, it's still up to the resident to make those decisions. So
Yeah.
we do our part, they still have to do their part. And
Mhm.
especially when they're at home, they have to do their part. And I know there's other
Mhm.
programs out there that can help with like grocery shopping or cooking and making sure they're getting those the nutrition they need and having a healthy balanced diet. But again, they still need to make those commitments and decisions.
Mhm. Mhm.
um I
Very
wanted
true.
to ask you, where do you practice? If someone was in the area that you practice, how could they get support or contact you if it's an adult child, or a senior themselves, or just someone that's looking to get more knowledge on their gut health and possibly get some support from you? How can they get in touch with you?
Okay, so first we offer free webinars, actually every month or every other month. Everyone is welcome to come to our website, which is rekhamuralimd.com. And you can come there and you can subscribe to our email. So anytime some webinar comes, we send all the emails out for the links and we have people join us. Secondly, my office is situated in San Ramon, and it's on 5401 Norris Canyon Road, Suite 204, San Ramon. It's very close to the hospital and the San Ramon Valley Hospital, which is right next to the office building. And once you come there, we do offer in-person as well as virtual visits. So for the convenience of patients, I do prefer to see the first visit in person when they join our practice. And after that, they can choose to either come in person or see me virtually. So that would be the two ways to, see us in the office.
I love that.
And
And just to clarify, that San Ramon, California.
yes, California, sorry.
If someone is not in California, in the Bay Area, near San Ramon, is there resources besides the websites that you gave us that they can go to try to find where could they look for a functional medicine
Yes.
specialist in their area?
Yes, actually, the Institute of Functional Medicine, the IFM website, has a listing of all the certified functional medicine practitioners. So it would
Great.
be good to see in your area who's nearby, and you can make an appointment through that website.
I love that. Thank you. Well, thank you so much, Rekha, for being here. I seriously could spend hours talking to you about gut health, functional medicine, and the do's and don'ts. I would love to have you again in the future. And just thank you so much for enlightening us, educating us on our gut health. And it was a pleasure to talk to you today.
Yeah, it's been my pleasure. I'm so happy, someone can learn something about functional medicine. And with all the resources out there, I hope everybody stays healthy. Thank you.